This show is coming live to you with hosts from Brazil and India and guests from Malawi. Welcome to this very special joint presentation of Talk to Brazil podcast and the KJ Masterclass Live of India. Talk to Brazil podcast is hosted by Tom Rioch. My dear friend, you can see him on the screen. The man who is known as the king of networking in Brazil. Talk to Brazil was founded by Tom in 2009 as the first English language internet radio program. And he talks about business in Brazil and the world. And now it's available in podcast format. The KJ Masterclass Live of India, a show which ensures that you profit from your time spent here with experts, either through their industry insights, information, or simply learning from them. And our esteemed guest you can see on the screen from Malawi is Amb Moses Davide Busher, Regional Director for Africa, YORGHAS Foundation. Welcome to the show, Moses.
Thank you.
Thank you. So hold on a minute. First, I would like to welcome, and say a huge namaste to all the people who are listening to us, especially in Malawi. It's also known as the warm heart of Africa because of the warmth that the people exude there. Even they say they are very comfortable to say hi to strangers, and that's something Indians can also relate to a lot. So namaste to everybody in Malawi, in Brazil, and everywhere else that the show is being watched or being listened to. So now over to my friend Tom Rioch in Brazil to take it over from here.
Well, hello, everybody. And Kunde, thank you for having me on. And Moses Busher, thank you for being part of this, our proof of concept experiment of co-hosting together with AJ and wanting to talk more to the world. Each of us have done that individually. Our focus is now changing to other areas, specifically to where you are in Africa. So we do want to thank you, Moses, for sharing your time with us. To our audience, Moses Busher is an experienced NGO management expert. He grew up in rural areas of Malawi. He attended school in a village called Biro Village in the Chikiwawa district. He is a writer, mentor, education expert, regional director responsible for Africa of YORGHAS Foundation International, an organization that exists towards improving women's access to maternal health care, equip maternity wards, provide trainings for medical staff to improve the standards of perinatal care, implement key child care practices, and do all to decrease maternal and neonatal mortality ratio in African countries. Moses Busher has 18 years experience in senior positions, worked for local and international NGOs. He's a member of Light for the World, a board member of Malawi Network Against Trafficking, the CEO of Center for Children's Affairs in Malawi, an advisor of NGO leadership and mentor of youth NGOs in Africa and locally. He has vast experience in resource mobilization, policy development, research, advocacy, monitoring and evaluation, public relations, and a global peace ambassador. So again, thank you for being with us. We see and hear what you do in Africa is also part of the challenges that we face in Brazil. And speaking with Kundai, we face obviously in India and other parts of the world. So thank you for your efforts and welcome again.
Yes.
Thank you so much. I really appreciate.
Yes, Moses, you have so much of experience and skill sets that it's very difficult to start from one point, and with addition of YORGHAS into your profile, there is so much to talk about. So do share us a bit about Malawi and about YORGHAS Foundation, what you do there, and what are YORGHAS plans out there. What exactly is YORGHAS, so that people in Brazil may be knowing, but for people, especially in a place like India, can understand what a great NGO it is and what it is doing in terms of healthcare and other spheres of life.
Thank you so much, and greetings from the warm heart of Africa. Greetings from Africa, Tom and Kudania. Greetings from Africa. Once again, thank you for the wonderful time, and thank you for the invitation. There are quite a lot of people that could be available today to be part of the show, but you saw it very important to include YORGHAS Foundation to be part of the show today. I really appreciate on behalf of YORGHAS Foundation, and also you really saw it very important to host a show from Malawi, and I'm sure this may be the first show from Malawi. Thank you so much for considering Malawi. Once again, my name is Moses Busher. As Tom already presented my bio, of course, there's quite a lot that could be shared, but because of time, I'll try to be more of brief. Malawi is a warm heart of Africa and a very charming country, a country that is located in the southern of Africa. It's part of the SADC region. And Malawi is a country, a youth nation with now about 19 million people, with the young people holding the stake of the population. More than half of the population are young people. And the country is dependent on farming. We are a country that is rooted into production. We're quite a lot depending in farming, and we happen to be one of the countries where YORGHAS Foundation chose to put the headquarters for Africa, and now the office for YORGHAS Foundation Africa Regional Coordinating Office is in Malawi, and YORGHAS Foundation is a Poland-based organization that was established and founded by two Polish women, very passionate of promoting maternal and child health, with an emphasis and a passion to see that we do not see and we do not continue to experience maternal and child mortality in Africa. You know, the unique thing is these two ladies, when they founded YORGHAS Foundation, their heart and their passion was to make sure that YORGHAS Foundation works in Africa. They are not from Africa, but they're passionate, their heart is in Africa. YORGHAS Foundation is working in Africa 24/7 and is based in Africa, headquartered in Poland. YORGHAS Foundation focuses on maternal and child health to make sure that women and children do not go through the usual and the issues that women and children have been experiencing, especially in accessing to health services. And again, we also focus on promoting education, and our focus in education is to promote inclusive education. We make sure that children with disabilities, they should have equal access to education, just like any other children without disability. So we are doing quite a lot. I also mentioned on what we have done about that. And lastly, we are also working on inclusive maternal health. We would like to see that women with disabilities, they have got equal access to maternal health services in rural areas. You know, people with disabilities, especially women, sometimes we regard them as people who do not have the right to access maternal health care services. Sometimes we regard people with disabilities as marginalized. They have got equal rights like everyone. disability is not inability. So we would like to make sure that women with disabilities, they have got clear, equal, and accessible rights when they're accessing health care services. So as the YORGHAS Foundation, we are working, as I said, in Africa. We are in Malawi, we are in Tanzania, we are in Kenya, we are in Uganda, we are in Sierra Leone.
Okay.
Very good. If I may, I want to commend you, David, for what you've just said, and comparing that to a reality here in Brazil. We have the same situation, a similar situation, and obviously health for women, not only in childbearing age, but health for women in general, needs to be focused. Women, because of a number of reasons, they have more health requirements than maybe men have. But specifically in the childbearing age, a healthy woman will generate a healthy baby. And
yes,
so
sure.
it really starts there. So to look at the woman's health, women's health in general, having adequate treatment while during their pregnancy doesn't necessarily guarantee, but it helps to have healthier children. Because what we see, what you've just said, in Africa and here in Brazil and probably in India, women are still playing catch up. We do have in Brazil a large population of children who are undernourished, that have problems. So a healthy woman is a basic necessity of humankind today. So that focus by the two Polish women is essential. But not only the focus, it's important to have an infrastructure, an organization like you have, to do something about it. Because many people talk about the needs, but an on-the-ground organization with people like yourselves making it happen is where the success will be found.
Right. Moses, you got
Yes.
anything to say on that, please?
You said?
Yeah, about health of women, women welfare, infant mortality, all that stuff. You people are quite focused on that. So Tom just mentioned about how important it is to focus on such topics, such issues, and you people are already doing that. So would you like to speak a bit more on that?
Yes, it is very important to focus on maternal and child health. When you look at the statistics in Africa and quite a number of countries in the sub-Saharan Africa, maternal mortality rate is very high, unlike European countries. This quite sometimes accumulated and influenced by scarcity of healthcare facilities. Sometimes you find that the distances to access maternal healthcare services, a healthcare infrastructure, a hospital, a health center, the distance sometimes is not equal, or I may say, for the woman who is pregnant to travel to a health center or a clinic where is going to have the delivering services, the distance is too long. So this also affects the fight against the maternal mortality, and again the issues of information into the communities. You know, in Africa, especially in sub-Saharan Africa, we have for quite a long time believed in giving birth in villages. You know, the traditional birth attendants. Traditionally and culturally, we have believed to say giving birth at home in villages is more safer than going to the hospital. because of the issues of the distance, and sometimes the issues of attitude. You know, sometimes quite a lot of people, they have complained in the issues of the attitude of nurses, the health care workers, the attitude, the way they handle women who come for delivery. That attitude also affects people, affects men, not to go to the hospital, or they prefer to deliver in the villages. This has also contributed quite a lot in the issues that affects women. When you look at some complications related to delivery, you need cesarean section. A woman needs to undergo operation, but in the villages they cannot go under operation. They cannot have that facility or service of operation.
Right.
This also increases chances to lose the lives of the woman and the children, lose the life of the woman and the kid. So there's quite a lot of issues, and that includes as well poverty. Some people, they think going to the hospital, they will need quite a lot of things to take them to the hospital. Some they think about transportation, some they think about food, and some they think even about paying to pay in the hospitals. So these are some of the key issues that also affects our work, or the work to fight maternal mortality. So as an organization, we are here to say we would like to join with the governments, the nations, to fight maternal and child mortality. We cannot manage to do everything, but we would like to make sure that we also contribute to what the government is doing. You mentioned about training healthcare workers. This is one of the key areas of YORGHAS Foundation, to make sure that we build the capacity of the healthcare workers. We also have a component of providing mama kits. Mama kits is one of the key components in YORGHAS Foundation. We would like to provide basic necessities for the woman during delivery. There are quite a number of small things that may look small, but in the villages, they are regarded as one of the basic or very important facilities that can help a woman to deliver safely. I can give you an example. In one of the health centers in Malawi, we call it Cheese Island. Cheese Island is an island at Lake Chira. This is one of the biggest lakes in Malawi, and this is the health center where it also quite more than 30 villages that benefit from this health center. But there are quite a lot of issues that are happening. The health center, as I'm talking now, doesn't have electricity. The solar power system that was installed there, it's malfunctioned. It's not working now. There's no water. As I'm talking to you now, the borehole that is used to supply water into the health center, it benefits a lot of households. So because there's no enough water sources in the villages, they are also benefiting from the borehole at the health center. This has also attributed to the health center saving quite a lot of people and saving more hours. Now it is no longer working. It means the health center doesn't have water. The health center doesn't have reliable toilets. The toilets for the staff, the toilets for the patients, they use one toilet. And it's dilapidated, or the toilet that is not working properly. And now let's come back to distance when there's a referral. And this health center cannot do cesarean section, doesn't have cesarean section. It just does normal deliveries. And when the time comes for referral, a patient, a woman who is in labor, has to be taken to Zomba Hospital and has to close the leg. And crossing the leg, it takes about 1 hour. During the manual boat, manual canoe, has to take a woman in labor to a mainland hospital. Now, let's think. A woman is in labor, and we want to take the woman to a hospital, crossing the lake, 1 hour, 1 full hour crossing the woman on the lake. And let's now think about the storm. In some cases, because of the weather, the boat may meet challenges along crossing the lake. We have lost a number of lives of babies because we want to leave for the woman in labor, our mother in labor, to the mainland hospital. And in the course, we lost lives of our babies. These are the cases. This is just 1% of the cases that are happening in Africa. So in such cases, there are even in other centers, in other places, where to get an ambulance, to get a referral woman who is in labor to another hospital, an ambulance is not available. You call for the ambulance to come, the ambulance saves quite a lot of population. So these are the cases, these are the issues that we need to address in Africa. That's why YORGHAS Foundation is here. We would like to work together with governments. We cannot work alone as YORGHAS Foundation. We want to work with governments, support the government where we can manage to support the government. We cannot do everything, but we say we have got the capability. We can work with our partners because our model of working is to work with partners. We don't work as an organization direct. We develop partnership with organizations in the country, and then we sign MOU with the partners. Partners help us to implement. We work with the governments. We do not work in isolation. Every time we want to do a project, a program, we make sure we involve the government departments. So in countries like when we come to Brazil, we work with the government. We work with the partners in Brazil. We cannot just come in Brazil and work. We cannot just come in India to work. We would like to partner with organizations in India who knows the problems in India, in areas, in cities, in counties, in districts, in suburbs. We would like to involve partners on the ground, organizations that are capable, that knows the challenges better. Like the case in Malawi, we're going to work with partners in Malawi. We're going to work in partners in Tanzania, working with partners in Sierra Leone, working partners in Kenya, working with partners in Uganda. Wherever we're going to work, we're going to involve partners. So we would like to make sure that our approach is approach that is participatory. Let me also, before I finish, we would like to make sure that our approach is our participatory, where communities are empowered. We don't want to put communities as the last beneficiaries, but we want to make sure that communities are in the forefront of planning, communities are in the forefront of implementation, communities are in the forefront of monitoring, communities are in the forefront of evaluation, communities are the beneficiaries of our program. For the programs to be sustainable, we cannot leave out our local leaders. We would like to make sure we work with religious leaders. We want to work to make sure we work with local leaders. We want to make sure, you know, we have got, when we go to India, there's the Islamic community. We cannot isolate working with the community in Islam, the Buddhism, whatsoever that is involved in the approaches of our work. We would make sure we work with all the communities, and that's how our model is.
Okay. Tom, carry on.
I just want to commend you on what you just said. The description of the situation in Malawi, we could take that same story, change the country, change the village, change the area name in Brazil, India, and many other places of the world. But what you mentioned here at the end, I think the essential thing, and I see that here in Brazil and many other places, it needs to start at the community level. Obviously, yes, governments, whatever their sizes and types are important. The infrastructures you mentioned is needed, logistics, transportation, what have you. But if a movement doesn't start, and we call that the grassroots, if it doesn't start in the local community, it's very difficult to wait for the top-down approach, because the challenges are the size of the countries. They're huge. If we're talking about the continent of Africa or Latin America, Southeast Asia. So it's just not one government that's able to do that. Obviously, there are governments that aren't interested in doing that. But the community shares the challenge. The community at the level shares the suffering of what is literally happening. The lack of water, lack of infrastructure, lack of electricity, lack of sanitation exists here in Brazil. So there are communities where you may have a health center, but no running water, no flushing toilets, no ambulance that can come if needed, and certainly probably not an intensive care unit, which is needed. Obviously, many births can happen naturally at home, but it's when a crisis comes that you need an intensive care unit, you need specialized treatment. That's the differential. That's anywhere in the world. And that's in any part of anywhere in the world. When something happens that normally happens at birth time, you need capable healthcare personnel and equipment and intensive care units to help either the mother or the child together. So, but the focus is on the community. So the more, and that's everywhere, AJ, we see. It has to start low. If you involve the community, they can do this one step at a time. And again, commend you and the organization for that outlook. We need the government, you have to involve them, but change really happens in your neighborhood.
Absolutely. Absolutely, Tom. And in fact, Moses, I would like to understand, you are now having more focus on disabilities and mental health. Now, that's two more addition to the work that your people are already doing. Can you tell us more about disabilities that you are focusing on, especially mental health? I feel that it's a rising global problem with, things happening, and it's affecting the way people think, the way people go about their daily lives, and they are not even aware that how issues in their day-to-day life have impacted their mental health. Please do tell us about these two topics in detail.
Thank you so much. That's very, very, very true and very, very important. Let me start with the issue of disability. For quite a long time, the issue of disability, it has not been on the center point of planning and development in quite a lot of programs. When you look at history, when you look at the background, you will find that quite a lot of people with disabilities were not having access to proper education facilities. Mm-hmm. When you go to education facilities, you could not find education system accessible to people with disabilities. When you go to offices, you could not find people with disabilities working in the offices. You invite a person with a disability for an interview. People could not give a person with a disability access or a right to be employed. People could define a person with a disability as a person who cannot do anything. But that's not the case. We are wrongly defining disability because the society did not accept development to be also focusing and putting people with a disability on the center point. We did not involve people with disabilities in planning. We were speaking on their behalf instead of letting them to speak their issues. There have been a lot of cases where parents could keep children with disabilities in the homes, in the houses. Children with disabilities should not go out. And in some traditions, in some countries, when you have got a baby with a disability, it was regarded as a cursed family. I hope you can agree with me. In Africa, when you have got a baby with a disability, in some countries, it means there was something that a woman did. It was believed that a woman was involved in fornication. It means a woman slept with another man behind the husband. There were quite a lot of beliefs. it means the gods were not happy with the family, or else the child with a disability will be a witchcraft, will be a wizard. Quite a lot of issues, but that's not the case. Now, when we realize that disability is there's also a rights associated to people with disabilities. When the human rights, it was enshrined in our constitutions in the countries, disability was also included in programming. Now, in other countries, we still have quite a lot of problems. We still have quite a long way to go to include disability in all aspects of programming. Nice and good that nowadays disability is being included. That's where there is inclusive disability programming. We would like to see that there's quite inclusion in everything. There's inclusion in health, there's inclusion in education, there's inclusion in employment, there's inclusion in education. In anything that we're doing, we would like to make sure that there is inclusive approach. Now, my point is, when you go to education, now you'll find that education system, they have managed to make sure that children with disabilities, they should be given equal opportunity from primary, secondary, up to university. Sitting in a classroom, there must be a special consideration for a child with a disability. If a child has got a problem with the sight, should be put in the front desk, should sit in the front. If the child, there must be children with a problem with the sight, the roofing should be included with the iron sheets that are transparent. You know, those transparent iron sheets should be included when we are roofing the classroom. Whether there is no children with a disability, but a classroom should be child-friendly, should be disability-friendly. Because of issue of diagnosing children with disabilities, we have failed to include children in education with disabilities. So governments, they have now started through the Ministry of Education, the Department of Education, to do diagnosis process. When children come in school or in schools, there must be a process where either every term there is a facility or one person, a teacher trained to do screening. We would like to make sure that education system does screening every end of the term. In healthcare services, we want to make sure that healthcare providers, they are trained in screening or identification of disability. These are the issues that we would like to make sure that inclusion is considered in everywhere. And when we come to the issue of mental health, when you look at our system, our society in Africa and in the world, it's not only in Africa, the issues of suicide. Suicide is increasing each and every day. And when you look at the statistics, suicide is increasing in men. Why is the suicide increasing in men? Our programming as a society, as nations, we have put quite a lot of focus on women and girls. We are leaving men who have got also a lot of issues. You know, men were born that we do not share our issues with everyone. Right. We don't have a platform where men, we are being considered to be heard. When you go to court, a woman is heard quickly than men. We have been considered that women cannot violate the right of men. Men have been considered as violators always. When you look at issues of gender-based violence, it's always men. We have always put women on the forefront as victims in gender-based violence, forgetting that even men, they are also going through a lot in terms of gender-based violence. So men, they are dying in silence. So a lot of suicide, mental health issues, it's in men. A lot of men, they are involved in suicide because we do not have time to give to men. So as a society, I think now we need to make sure that today, if Tom, looking at the age of Tom, he has passed a lot. IJ, you have passed quite a lot in life. You have got quite a lot that you can share to men. But looking at Tom today, if I can ask Tom, you do not have time to sit down with men to talk about what you have gone through. We would always want to give space to women to talk about what we are going through. Why not men? We are not giving space to boys. A lot of boys, they are in suicide because you find that the issues that they are committing suicide is because of issues of relationships. A girlfriend has just said this to the boy, or the girlfriend is no longer interested with the boy goes out for suicide. We will find that, for instance, a wife slept with another man and the man goes for suicide. Do you want to tell me that if a wife is engaged in extramarital affair, a man should go for suicide? Is that the end of life? Why have we accepted the society not to listen to men? We need places where men can come and have time to associate men, boys and men to associate, have time, share issues. If today we can have a conference for men and we ask Kudania to share his personal experience, people will learn a lot from Kudania, how you managed to handle issues of in your family. At your age, you have managed quite a lot of issues in your family. You have managed to accept, you have managed to avoid, you have managed to get counseling from people. You have managed to avoid unequal counseling from fellow men. These are the cases, these are the issues we need in the society. These are the issues we need as a country, as a world. Let's move away from approaches of discrimination. I can say approach of discrimination, where we have put women and girls in the forefront, leaving men and boys as perpetrators of violence. We're leaving men and boys as perpetrators of bullying. We have been translated, we have been defined men as people who do not love. We love, we care a lot, but we are not given space where we can also talk about what we are going through from our wives. So these are the issues that we need to target. Mental health issues is none other than issues of relationships, issues of finances, poverty, issues of lack of platforms to share our problems. So these are the issues that we need to handle. Yeah.
Tom.
I can only say, Moses, you have given us, and that's to Kundai and I, about 14 different topics for different programs here. And I do agree with you in your last statements about, let's call them gender issues, the mental health, the mental states. And I agree with everything you said. And me as a man, I have to admit, it's just not natural to sit down and share your problems with other men. Here in Brazil, and I'm an American, it just doesn't happen that way. Because we tend to keep things to ourselves. That's one of the things that people say to me, well, why don't you talk about it? Well, I'm talking about different things, but I'm not talking about myself. And we tend not to do that. But I think the point is given, and it needs to be highlighted. Suicide is a factor, and it's an extremely dangerous thing that happens. Many times, unfortunately, the person, before they commit suicide, of taking their own life, we see they take somebody else's life. So it's a multiple problem, a multiple crisis. But the points you talked on, they all intersect. We started talking about, you talked about education. I agree with you. That's the basis, that's the root. And back to what we previously mentioned about the women, the maternal health, it's the community. So at the community level, education needs to start. It needs to start in a family. And to that to happen at the local level, customs have to change, cultures have to change. You've mentioned the cultures in some of the African cultures, which are true here in Brazil, but throughout the world, we have our local cultures. We have our local ways of thinking, of doing things or not doing it, not sharing. So those points are well taken. It's education, health, poverty, and I'm going to put men as a category, AJ, for us to think about the gender issues. Those are multiple topics that are not local. They're not Africa. They're not Malawi. They're everywhere. And solutions can come. You have shown that solutions can come at a basic level on what you're doing, having foundations that help you help others. And what AJ and I think we want to do is to help others, help themselves, and help others again. So I want to thank you for your presentation. Thank you for your thoughts. And thank you for enlightening us on the path we want to take. AJ.
Yes, Tom. In fact, it's nice to understand issues from different perspectives, like the issue of men, mental issues, the societal issues, that they don't have platforms to vent out their feelings. So I can relate to that. I understand from an Indian perspective. Here also, it's not too different, and that needs to be taken care of, not only in Brazil, in India too. Moses, you have voiced out something that not many are able to voice out, that too on a platform, and so passionately. It needs a lot of courage, because it is a real issue. In fact, in India, courts have also had to come on openly in several occasions when they felt that certain laws were made for the benefit of of our women folk, who are not able to, who don't get the amount of respect or benefits that they should get in. But then there are some people who may misuse those laws for their advantage, and then some people come out as victims because of that. So courts have come forward in India, taken some state, diluted the earlier laws which were misused. So, and this is a growing campaign. There are organizations which are coming up, and at the same time, laws that were made for women who are in different, for example, the issues of women in a smaller place will be different. And in an urban place, for an educated women will be different. But sometimes,
yes,
but the laws are the same across the country. That won't differentiate.
Yes.
But people who are aware, that's what sometimes educated people tend to misuse laws. Some of them, and that's a very unfortunate part. I guess that's where a lot of understanding needs to develop. Organizations need to develop, and platforms need to come up where men can also share their part of the issue. It's always cannot be that they continue to be silent sufferers, because that's been the way in many countries. That's what I can say. And moving on from this, Moses, like YORGHAS is now focusing more on infection reduction. Can you tell us more about that? This is one of our last questions now on this. We have already, focused on the Chisi Island issue, so that has given up quite some perspective. So if you can tell us on infection, are you talking of HIV or any other infection?
Yeah, beautiful. This is quite another alarming issue. Recently, the World Health Organization released a report where it indicates quite a lot that some of the almost more than 80% of infections that people gets in the hospitals, at home, they have led to deaths. There are quite a number of infections, like infections that during the cesarean section, when a woman delivers through cesarean section, you know, that operation, when the woman gets back home, that wound gets more infections, bacteria affects again the wound. Instead of the healing of that part that have been operated, that underwent cesarean, it gets back worse because of the infections and the bacteria that gets back into the wound. And some of these cases, they happen because when a woman leaves the hospital, goes to the village, the care for the wound is not all that we get in the rich people, you know. And even the type of the hospitals that people go, these public hospitals, they may not have that quite powerful medication that can sustain the woman after operation. Those infections, the bacteria, they affect that part more than those people that underwent operation, but in the well-to-do hospitals with powerful medicine or powerful treatment. So these infections, they affect quite a lot. And also during the emergencies, for instance, during the road accidents, quite a number of accidents, there's when the people sustains injuries, there's a high rate of infections into the system of the body through that injury. So as an organization, we have partnered with infection reduction program. Infection reduction program, they have got a product that is called Irrecept. Irrecept is a product that will be used throughout in quite a number of countries, but now it is being tested in Africa, and one of the countries that will benefit the testing is Malawi, and also Zambia. Nigeria is also benefiting in the testing of the product. So Irrecept is a very powerful product that when a woman or any injury, a woman undergoes operation in the cesarean section, this product, Irrecept, will fight infections, will fight bacteria, 99.99% fighting infections. So we are assured that when governments adopts Irrecept, it means, for instance, if the government spends $38 million a year to treat infections-related sicknesses, it means the government will have a reduced amount that will drop even up to let's say $20 million from $38 million. So the government can save about $18 million from infections-related costs. It means Irrecept product will help the governments to save lives of many people from injuries, from operations. These are the cases related to maternal health. So we're going to save lives of our mothers. We're going to save costs related to treating women in the hospitals after cesarean section. We are going to also have quite a lot of healthy nation. When a person is having infections, it means the person will not be healthy. So as you already said, healthy people is a healthy nation. And if you're going to have healthy people free from infections, free from bacteria with the product Irrecept, it means we are going to have nations that are centered on saving lives and also saving costs related to the infections. I can also give you an example to say if Malawi has, let's say, 40,000 treatments related to infections. We are going to reduce the number of days where a patient stays in the hospital because of infections. We are going to reduce rates, or we're going to reduce costs that a government spends. It's not only about the product or the drugs that are used to treat the patient, but we should also look at how much money does the government spend to feed a person in the hospital who stays for 2 weeks getting treatment. What about the bills of the water bills? What about the electricity bills? And even the person as well who is in the hospital being treated because of infections, when we calculate how much money the person makes in a day, if a person makes $10 per day, it means, as I said, in the hospital because of infections and bacteria, 2 weeks, we calculate 2 weeks by $10. It means the person stays in the hospital missing more than $20 or $300, $500 because of treating infections. If the government adopts the recept, it means the person will stay in the hospital 2 days or be treated home, but 100% assurance that the person will not return back to the hospital to be treated in the same issues of infections. So this is another program that we are going to launch with our partner IRP in Malawi and other countries in sub-Saharan Africa. So I'm sure we will have another opportunity again that will be hosted again in this show to share with case studies, share about the progress of infection reduction program as a case study for Malawi, so that other countries, they can also learn from our program.
Mm-hmm.
Sure.
Right. Tom?
Again, Moses, we're back to the basics. When we talk about health, health is so inclusive, and you've talked about inclusion, and it's back to the basics again in the community. The economic loss that you show just from infections reaches everything we just talked about. So people who are in a hospital under care, that's a cost to the government or the community. The loss of engagement, the economical engagement by that person or those persons is another factor. So at the end of the day, we don't have money to pay for the projects that we need. And at the same time, we're spending the money that we have and keeping our population outside of the economic activity. So it's a revolving situation. And again, back to the community, the changes have to come at that level. The money savings that you mentioned, the time savings and the health benefits will be seen at that level. Many times when we're talking about governmental or nationalistic levels, we're just looking at numbers, we're looking at statistics. But when you take things into the scope of a community, you're talking about people. You actually see the people who are getting the benefits.
Yes.
So I think that's where what you're doing is trying to focus. The problems, the challenges are many. From what you're saying, you have several organizations helping into adjusting that, not only in Malawi, but throughout Africa. And those are the steps that have to be taken. AJ.
Yes, I think we have discussed quite a number of issues, and especially YORGHAS Foundation, Regional Director for Africa, our friend here, Mr. Moses, he has spelled out a lot of things, talked about Malawi. We learned a lot about Malawi. And he also talked about Brazil, how there can be more opportunities for them in Brazil, also for India in the coming days. Mm-hmm. And he also focused on several issues that people know about, but are not so passionately vocal about. In the days to come, as Moses said, we will certainly look at talking more and more. And from my perspective, you see, it's an honor to host you, Moses. from our,
Thank you.
from a country in Africa, very close to our heart. Africa is very close to us. And we feel, you see, you people suffer a lot of same issues that we do in India. Brazil also, I'm sure, Tom, you can relate to that. For me, it's a great honor indeed to be able to host this show, co-host this show with my senior host, Tom Rioch, the king of networking from Brazil. And I hope to keep on getting this opportunity again and again. We are looking at a much more bigger entity to host, co-host shows. So we'll keep you informed. But certainly this is not the first of the shows together, and especially with you, Moses. On this,
Thank you.
On this note, yes, on this note, I can say, as we can continue talking, but there will be more and more time to come. It's already, we have covered 56 minutes, 10 seconds, and it's ticking, the clock is ticking, but, and our show will continue to carry on, and we'll carry on talking more and more about different issues. Tom, any last words? And then we'll go for a closing of this one.
No, just to thank you again, AJ. Thank Moses for sharing. And I think our views, our mutual views, depending on which way we want to look, if it's Brazil looking towards Africa, India looking towards Africa, Africa looking towards India and to Brazil, there's much to learn for all of us. And just look anywhere. Just keep looking and keep trying and keep involving people. So thanks for the opportunity.
Thank you. Thank you. With this, it's a wrap on this edition of the joint presentation of Talk to Brazil podcast and the KJ Masterclass Live of India. Thank you very, very much. Thank you indeed.